What is COVID-19? Coronavirus disease or COVID-19 is an infectious disease caused by the severe acute respiratory syndrome coronavirus 2, that is SARS-CoV-2. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. Rank of India according to the rate of COVID-19 cases. India has reported more than 33 million COVID cases, second only to the US. The country is also only the third in the world to record more than 440,000 deaths behind the US and Brazil. But then how is India managing it? Since 16 January 2021, India has administered more than 790 million doses. About 590 million people have received the first dose and another 196 million or so have received both doses so far. Experts report record-breaking days are encouraging, but vaccination rates need to rise consistently. They estimate that India needs to give more than 10 million doses a day to fully vaccinate all eligible adults by the end of 2021. Hence, much will depend on levels of vaccine hesitancy and the availability of doses in the upcoming months. Urban versus rural. Although a higher number of doses are being administered daily in rural areas, the share of population being vaccinated in urban areas is still greater due to some reason which will be explained in the upcoming topics. Plans and expectations. The Barclays Bank expect a material acceleration in the vaccination rate in the next few months, with 35% of the population fully vaccinated by the end of October and India on track to provide over 1.4 billion doses by the end of 2021, which would equate to coverage of 52% of the population. The government is also planning to leverage the use of drones to enable steady access to COVID-19 vaccines even in remote rural hamlets. The pilot drone delivery program has also been initiated in the second week of September.
India has the capacity to administer a large number of doses and has demonstrated this by vaccinating over 10 million people on a single day many times. With more vaccine doses becoming available, India can scale up the pace of vaccination even further. It has the systems in place to do so. A free-for-all vaccination policy has indeed made a difference to vaccination rates across the country. Not only has the pace of vaccination picked up, the distribution of vaccines has also become a little more equitable ever since. While India had administered only 284 million vaccines until June 21st, it has since covered 483 million people with the first dose and 143 million with the second dose. In all, 626 million doses have been administered across the country. The pace of COVID vaccine in India. India aims to vaccinate all eligible Indians by the end of 2021, but experts say the drive needs to pick up a consistent pace to meet the target. It has so far given more than 719 million doses of 2 approved jabs. More than half of India's eligible population, some 594 million people, have received at least one dose of a COVID vaccine, according to official data, where only about 20% of eligible adults have been fully vaccinated since the beginning of the drive in January. First week of India's vaccination drive, January 16 to 22, 12.43 lakh doses were administered. The second phase of the vaccination drive began on March 1st at 9 a.m. for people over 60 and people above the age of 45. On April 1st, the vaccination was expanded to everyone above the age of 45 years. The number of vaccine doses saw a slight dip by May end, when a total of 1.46 crore doses were given. However, the figure increased to 4.212 crore between June 19 and 25.
Why are people reluctant to take vaccines in India? Some fears the after effects, some are not allowed to do so. My name is Ritu and my friend here is Shruti, and today we are going to talk about the reluctance of taking vaccination in India.
The novel coronavirus first came to India on January 30th, 2020. Since then, many doctors and scientists have been teaming up to make a vaccine for the pandemic. Later on, in January 16th, 2021, a sanitation worker named Manish Kumar was the first person to get vaccinated in the presence of the Union Health Minister Harsh Vardhan. The vaccine was developed in a very short period of time, which is 1 year, so people are afraid of its effectiveness.
Even due to rumors such as death after taking vaccines, people are reluctant about taking vaccines.
People are also really afraid of the COVID 19 side effects, which include fever, headache, muscle pain, pain on the injection side. These side effects may be short term, like a few days, or long term, like a few weeks.
COVID 19 vaccines are not 100% effective. There are chances of getting COVID 19 even after fully vaccinated. The COVID 19 vaccines are a type of medicine that will teach our body to build the immunity we need to recognize and fight the virus if we become exposed, but not to get rid of the virus or make us recover from the COVID 19 disease. There is no lifelong protection for vaccines. If the virus is changing or mutating, revaccination would be necessary.
Covaxin was developed from the dead cells of coronavirus. People fear the coronavirus cells in the vaccine may become active again and hesitate to take that vaccine.
Also, many people, such as myself, are super scared of needles. And a recent study from the University of Oxford suggests that a fear of needles is a major barrier for around 10% of the population.
Not all people can take the COVID 19 vaccine. Due to low respiration problems, few people, such as pregnant women or people who are pre-diagnosed with a heart disease, cannot take vaccines, says the Indian Health Authority.
Wow! Who knew there are many reasons why people are hesitant to vaccinate themselves? But apart from these reasons, one must vaccinate themselves as it is the only way to safeguard themselves from the ongoing pandemic, regardless of how afraid they are to do it.
The coronavirus is a deadly virus. It has been in presence among us for about 17 months, and we are also playing a part by preventing ourselves from getting infected by the virus by staying home, exercising well, and getting vaccinated. But still, we can't forget the impact that it had made on us. Today, me and my friend Warren will be delivering a conversation on the topic: how has the coronavirus impacted on the human resource?
The pandemic has disrupted lives, pushed the hospital system to its capacity, and created a global economic slowdown. As the coronavirus pandemic rapidly sweeps across the world, it is including a considerable degree of fear, worry, and concern in the population at large and among certain groups, such as older adults, care providers, and people with underlying health conditions.
The coronavirus has taught us to be physically and mentally prepared in any circumstance. It has introduced us to the technology of remote working. It is because of remote working that we could connect and collaborate with people from a house.
The coronavirus has also changed schooling into a whole new way of functioning, that is, through online classes. Teachers are able to communicate with students through online classes, correct their worksheet, and mark their attendance, etc. People selling items in roadside markets and small scale workers have faced downfall since the outbreak of the virus.
Most organizations across the world are facing numerous challenges created by COVID 19, and one of the most significant challenges is the increased uncertainty among most organizations, most especially concerning human resource control and maintaining a higher customer base through marketing. Most organizations have laid off their workers and consequently lost their customers ever since COVID 19 was declared a global pandemic, and this has greatly affected the profitability levels of such organizations, mostly due to the deterioration in efficiency and productivity of the human resource. The main challenges of most organizations today are very diverse as they cut across different complex issues that include climate changes, increased political instabilities in both developing and developed countries, and severe economic downturns. In the current dynamic world, the different organizational problems associated with the marketing and human resource management greatly affect the ability of an organization to operate strategically and achieve sustainable growth. By posing a great threat to the sustainability of an organization, these challenges enable an organization to be highly responsive and consequently adaptive to effectively organize and manage or control its workforce. Due to the coronavirus, the prices of shares in the stock market has sunk deep below. The rate of unemployment has also increased. The traveling industry is also deeply affected due to the virus, but the pharmaceutical sector has seen a large rise because of the development of vaccines.
The fact that we humans have managed to cope up with the coronavirus is astounding. We should continue to prosper even with the presence of the virus. Thank you.